can we remove a pilonidal cyst? Oh my goodness me, we've got all the questions of the cysts we can't remove. So that's kind of in the natal cleft, the pilonidal cyst. So it's the top of the top of the natal cleft. And again, can we? That's the question, isn't it? We don't do those cysts. Pilonidal cysts are usually due to hairs on your back. They're usually male people, and if you've got a hairy back, it's a thing. And they fall into the crack, the crack between your buttocks, and then they kind of work their way in and form a little sinus, and they can form an infected cyst. Jeep driver's bum is kind of what they call it. So it's for people, hot and sweaty Jeep drivers or truck drivers or things like that. And they can be very difficult to treat. They often get infected, and they can often drag on for a long time. Exacerbating factors are being overweight and smoking. The really bad ones are always in people who are overweight and smokers, because they reduce your ability to heal, and so it drags on. And if they get infected, they can form what's called a pilonidal sinus, which is like a connection between the cyst and the skin, and it discharges, stuff comes out, and it gets infected, and it's very difficult to treat and very uncomfortable for patients to experience. And it often will involve laying open, which often means kind of cutting an X and then cutting the corners off the X. So you kind of have a hole there, so that all the evil humours can come out, and you pack it, you put this pack in, and then the pack changes every day. This is something that I did when I was a general surgeon. The district nurse or whatever would change the pack every day, and you just gradually put less pack in, and it's a difficult problem. And only when they're kind of really big or really complicated would a plastic surgeon potentially get involved to sort of cover the defect if there's a big hole there. But the actual management of pilonidal cysts are usually, if it gets to a surgeon, would be a general surgeon who would be involved in getting rid of the infected cyst and maybe laying it open and packing it. So we tend not to do that one. So yeah, Baker's cysts and pilonidal cysts is two of the cysts we don't do, but we do all the other cysts, well, most of them.